right, here we are, Renee. Another episode. This one's already off to a rocky start. So tell me, what is it that we're talking about today?
Oh, Rocky is right. I got to spend a whole weekend in the Rocky Mountains when I was supposed to be in Montana with you at a conference. So, what we're going to talk about is what we learned in Montana for the conference. I believe it was the rural mental health conference in Montana. We'll have that all in the show notes for you. And today, we're going to be talking about what's the same and what's different. When we get across the country, we see some things that are very similar, but as you know, Montana is much more remote, much more frontier. And so I got a bird's eye view of that. But before we get into that, let's talk about what's going on in the farm and in the world in which you want to chat.
Well, I was going to keep it light today, Renee.
Okay.
I was reflecting back as I travel, I like to grab ice cream now and then. And, I've been looking locally here as well. And I think back to spring break, and I had two different flavors of corn ice cream. Now, why is it in the heartland of all of the corn that we have, I can't get corn or maize ice cream? I
I
thought it was very
personally think
good.
because that sounds gross, but
It was
that's why I would not eat it. But it
it
doesn't
was
mean that's why you
delicious.
can't eat it.
It was delicious. I had both a coconut-based maize ice cream. I've had other types of maize ice cream. And I'm just wondering why in this area we don't have corn ice cream.
I have not one idea why we don't, except I'm not sure I would eat it. But that's an interesting conversation. So, for those listening, I was supposed to be joining Jason in Helena, Montana for this conference. And weather in Denver is what started the issue. And so they diverted me originally to Bozeman, Montana, which is an hour and a half from Helena, if you know where Bozeman is. And Brent was in town already with Jason and was going to pick me up in Bozeman. That seemed like a logical situation until that flight got diverted mid flight and they landed me in Spokane, Washington. So I never made it to the conference in Helena. So today we're going to talk about what Jason learned at the conference in Helena while I was trying to recover from the longest night of flights in my life in another state. But I can join in the conversation related to the remoteness, the frontierness, and all the things that I've seen in the western part of the United States that I wasn't prepared to see. So, Jason, kick us off. Today, we're going to talk about what you learned at this conference. So, what kind of things did you figure out that kind of are similar? What are those themes that you're seeing that they're talking about too, just like we do across our part of the country?
Yeah, well, why don't we start with it was the Montana Healthcare Association, and that was their health summit. And so they have an annual health summit. I'm sorry, did I say healthcare? I meant hospital association. And I'm already completely discombobulated, Renee, because I was so responsible to be there ahead of time, go to all the sessions,
Mm-hmm.
and then I have to carry the load completely while you're just traveling around, visiting other states. And so I'm like, wait a minute, what am I doing wrong where I'm out here working,
Yeah. I
making
really feel
connections?
bad. The most I feel bad for is Brent because he came to pick me up in Bozeman. It was a 3 hour round trip for him in the
And
middle of the night, and I never made it to Bozeman. So
and he
he,
actually drove through a blizzard because I went to
which
get in
is
the car
why
with
the
him the
plane did
next
not
morning.
land.
And there
Yeah,
was ice underneath the car, just
yeah,
huge chunks of ice coming off the car. And I'm
yeah,
like, where
yeah.
were you?
That is actually why, I never made it to Bozeman. And so by the time this whole adventure ended, they wanted me to still fly to Bozeman. And I'm like, I never wanted to go to Bozeman. So
Well,
I didn't make it to Bozeman, but he did. He got the view of most of Montana on that trip. So there's that.
it does remind us though of how different it is when we're in real rural and frontier areas, right? And
Yeah.
so, we
Yeah.
spend we spend everything we do in traveling to rural and frontier areas. And so I think it helps give us perspective when we go to these conferences and we sit with CEOs of hospitals who are struggling. I think we can connect better with those folks, because that's a lot of what we talk about is, how do you recruit? How do you retain? How do you decide what service lines are going to exist? And how do we fill this gap of behavioral health when we really don't understand it? And it's so far to get to services. And, I think it's been similar to what we learned when we were in North Dakota, very similar when we're in Nebraska. We think about there's one state institution, and it's funny. It's not funny, but it's funny when we go to a state, and it's the exact same thing when I listen to the policy update from the lobbyists for the hospital association. It was the same conversation we've had 100 times, Renee. It was,
Oh,
the state hospital in Warm Springs. It's too far away from everything. We should
oh,
split it up into a regional center and have four different ones. And,
oh,
all the same conversations that I recall us having, when we were in North Dakota of should it be
oh.
in one location? Should it be split out? Should we
Right. So
consolidate? Should we not?
because I'm newer to the geography up there, is Warm Springs, I'm guessing, more east? Is it like towards Billings, or do you even know where Warm Springs is in relation to the size of that state? I don't even know if I know where that town is. Do you?
I I wasn't prepared on my geography because we didn't
Oh,
talk
I
about
didn't
that
know.
ahead
It's
of time.
okay. I didn't know if
Um,
you'd noticed
it's
that.
not
It
close.
wasn't a town. It wasn't a town I passed, and I
No,
did
it's
half the state, so it
I've
must be
never
on the
heard
other
of
half.
Warm Springs. It's not
Oh,
very
okay.
close to
Gotcha.
anything, which was part of the
Oh,
difficulty in
yeah.
them recruiting staff to be there.
Makes
And so
sense.
it's kind of a haul for anyone to get there. And of course, it's been there since the 1800s. It's a very long term, it's been there a long time. It needs updated. It looks more like a college campus, some people
Oh,
described to me. But, the solution in front of the legislature right now is to add 26 beds. And, Renee, what happens when you add 26 beds to an
I'm
institution?
I know. You fill them with people who have housing challenges and then you're full.
Right. And then you still have the same problem and you haven't solved anything. And so
No, you have not.
as I sat there listening to this, I just kind of scratched my head and went, well, we've seen this before and we know how
Yeah,
this ends because, it's really about that continuum of care and how do you move people through the institution and how do you reserve those beds for people who really need them. And I
right.
just feel like sometimes we're banging our head against the wall because bad ideas come from a lot of different legislators who I think
Right.
mean to do well, but just don't understand the
Yeah.
system.
So, and I know one of the things we always talk about too is just the transportation struggles of people getting to places. But this particular trip added a whole new dimension to that to my mind. And when
Yeah.
we head to Alaska coming up in a few weeks, it's going to be the same because one of the things some of these states end up having to do is flying their specialists or their doctors or their administrators from place to place. But like in my case, this last trip, there when the weather doesn't cooperate, there's no flying either. And so
Right.
it's not just, you can't get there from here. And still, I mean, this is, you're looking at April and May and there's still snow in the mountains. So some passes are closed. So you can't get through with, their cars or your trucks or your vehicles. And so there's just a lot more to that. We talk about travel concerns, rural all the time. But when you start thinking about frontier and mountainous communities, there's just seasons of time they cannot get people to them. And so even if you're thinking of flights and things like that, and there's a lot of stories about that flying is a big part of this whole
Hmm.
Western component, but you can't
Yeah.
always get there even when you have the vehicles. And so in my case, I had the plane the whole time. That didn't help at all getting me
Right.
to anywhere closer, right? It just didn't. And so you're thinking about those kind of troubles and it just exponentially. So trying to think about in my mind, you know, their conversation you were mentioning about trying to make it regional, that doesn't even make sense. I mean, the half of the Montana that I got to cover through all of this travel was mostly cattle and very few people. And the towns that you'd come up on that even made the big maps would be like 120 people. It'd
Right.
be, 30 people. And you'd find the town of, and there's literally 5 buildings total. And so that would be the town. Well, I don't even know if you call it a town, whatever they'd call it.
Right.
But that's what made the signs of where you were going next. And so you would be like, okay, let's stop at this next town to find gas
Hmm.
that's not a thing. So you think about just how little is available in those communities anyway, and then you're trying to add healthcare on top of that. They have to travel for miles and miles and miles to get to any kind of even primary care, let alone specialty care.
Yeah, and I mean, so there's been a behavioral health commission who's been looking at these issues for the last 2 years. And so, we spent some time kind of looking at that and having conversations, listening to what they've done around transportation. Mobile crisis is really has not happened there. I read an article like a year ago and there was like a really exciting pilot project happening.
Mm.
Well, no one I talked to knew anything about that pilot
Oh
project
no.
and said, "Oh yeah, that's not a thing here."
Oh no.
So, it's again a good reminder that sometimes we read about these innovative practices or
Yeah.
pilot projects, and so oftentimes they fizzle as quickly as they started.
Mm.
You get a great article that goes out that shows research was done and it shows this, but it's not sustained. And I think that's a lot of what I heard about happening in Montana is that this commission, there's been a research project for 2 years to kind of look at what the continuum is, but
Mm,
no traction, no real movement forward other than adding those 26 beds in the
right.
institution. Medicaid rates, of course, are an issue and concern. And CCBHCs are just looking to get funded this session, but they're not sure how to implement that. And, federally, we don't know what that looks like either. So, boy, it was kind of doom and gloom in the mountains of
Mm,
Montana,
makes
Renee, when
sense.
it comes to behavioral health integration in critical
Yeah.
access hospitals, because there was a lot of CEOs that I sat a couple tables of CEOs for breakfast in the morning, and they're like, we wish we could do more behavioral health, but we just don't know how to access it. We don't know how to retain the staff.
Right.
It's a
And
big
and
gap.
another piece of this that, sometimes we take for granted. We talk about it in our state, but the lack of even ability to connect via telehealth. We literally were places without a signal and for a very
Mhm.
long period of time. And we were even trying just to get the basics of just the map. And one thing that happened with us, we were on an off-road, just doing the scenic whatever, and passed the turn. And then the only way we noticed is that you've got like a blip of signal that updated the
Uh-huh.
time. So the time, made it a lot longer to
Right.
get to your destination. But had that not blipped and saw that, we literally had no map. And so it's not like, I'm guessing people that live there probably carry their old school maps because they know better. But there's not even connectivity for a lot of these places. So when you're talking about some of the things that we can use for rural to help, it's not even available in these frontier locations and these really remote locations. And so for me, again, like you talk about, what's important when I travel to those kinds of places, that's what I'm seeing and thinking, and it gives me fresh eyes on these are really big problems. The other pieces of issues that we saw, and I don't know what if Montana talked about this much, is there's substance use, and maybe you remember anything that you heard about that. But in the state of Washington, that's a huge problem, and part of it is because of the laws that they've chosen and how they've allowed less
Mhm.
housed people to be around. But it's very visible, it's very public. It's not necessarily that we're treating them; they're just on the sidewalks. And I don't know if Montana struggles too, but I don't know how in the world, if there was like an overdose with the lack of even ability to get somewhere, what are the choices? So did you guys talk
It,
substance use much in Montana?
we did, and the response I got from the group I was talking with, which was a table of CEOs, specifically, I remember one conversation I had. They said, "Yeah, no." I asked about fentanyl and meth, and they're like, "Yeah, no, it's all alcohol in our emergency
Oh,
departments." They said
interesting.
it's all alcohol. They said we get very little other substances, and I was kind of shocked by that, because I think about our own EDs here in
Yeah,
Iowa.
yeah,
I think in Iowa, we're in the center of a lot of that drug trafficking, so
yes.
we have access to more. And so, in rural frontier areas of Montana, I just don't think you have the drug traffic, and so it falls back to there is legalized marijuana. I could see all the signs everywhere, and there's, Keno and gambling at every bar across the entire state. But I think it's alcohol and gambling are the primary issues that at least I heard from, and I don't have any statistics to back that one up. But
Okay.
anecdotally, I was kind of surprised that I didn't hear more of that.
Yeah,
Especially over in Washington, I think it does look a little different.
it does. And the liquor, man, that makes a lot of sense because to your point, they have what they call casinos attached to everything. But the combination typically is a place to eat, casino, liquor store. And those are
Right.
the three signs that you'd see.
Right.
And it's prolific in the communities that are big enough to even have that, right? We're not
Yep.
talking about some of those tiny towns, but I'm guessing those liquor stores or those bars are the only thing. The other thing that I noticed, just because I noticed, but they have a lot of those old time the VFWs still exist that's
Yeah.
around alcohol. The Elks Club still exist around alcohol. So some of those things, those bowling alleys that you talked about a few podcasts back that have gone away, a lot of places haven't gone away out in these more rural areas,
Yep.
but they're centered around alcohol. So that makes a lot of sense that is what you see. So it's interesting to see that that's what they're pulling in. So what else have you learned about any kind of data that you pulled from this conversation that you wanted to share today?
Well, in the show notes, we're gonna post a couple of the articles about some of the mental health redesign that's occurring or proposed. About extending those beds. It's House File 850 if you're following along in Montana. I always like to take a look at other states' legislation, see how they're doing, see how they're designing things. But once again, we know by adding those beds in Montana, it probably does put them over the national average. So, they incarcerate a lot of folks. When we looked at the mix of what some of those beds are, there's some kind of long-term living environment beds, like 34. And so we're not quite sure who's in those beds without digging in a little more. So,
Hmm.
we're always a little skeptical when we look at data and numbers of how many people are in an institution because, sometimes we know they throw a few kids in when it's adult only, or they have a different population there. And it's not always equivalent, right? The other thing to take away is everybody in Montana is paid for by the state because they got in a lot of trouble with Medicare and Medicaid. And so they lost their rating, so they can't bill anything. Um,
No, I didn't know
yeah,
this.
yeah. So,
Wow.
it's a big cost in that state because they haven't managed well, and their quality of care has
Whoa.
been in question. And I think that goes back to, somebody told me the date, but at least 5 or 6 years.
Really?
So that's also a pretty major barrier that they have when it comes to funding the state hospital and how they
I'm
move
gonna
forward.
go on a tangent for a second, but we had heard that in another state we were working in about some Medicaid fraud, and but they were, another frontier state, and they were like, "Oh, it'll never come to us." But that
Yeah,
means this could be happening to other states that we've worked in because we know that they weren't doing that correctly either. And if they can't, wow, it's interesting that the feds would have done something like that. But I get that if you can't adjust your beds. But this is one of those, my brain is automatically thinking they have 270 beds. But you and I know when we do the bed count thing, when we stand here, right?
right,
This state would be hilarious, I think, to go stand and see where these are located and actually go to
right,
physical count because nobody has. Because the state is
right,
so vast and large, nobody's gone to actually prove that those numbers are stand in that standing
right,
location aren't double or triple counted.
right.
But this could be a very interesting math problem. I really hope you get an opportunity to come do this with them because I think you guys could have a really good time just even finding the communities to stand in to figure out like where do you think these beds are? Because that would be a very interesting
Absolutely.
conversation.
Well, and that's a good transition kind of into our final segment of really thinking about how does the local community critical access hospital, how does a local community hospital fit into all of this, right? We talked to some larger hospitals that actually do behavioral health care, that have embraced it, that have therapy units, that have inpatient units as well as outpatient therapy units. And it's been very successful because
Yeah.
they're meeting the community need. And we're talking more and more about how can the hospital convene and network to figure out how do we pool our resources to make a difference. And that's been the discussion that we found gets the most people in the room of CEOs really saying, well, how do we do this differently? Because the need is overwhelming us in our emergency departments. And we're not getting the support from the state we need. How can we do this locally? And so, I think there's so much opportunities as we think about the hospital as a convener. We've been talking a lot about that lately because it's a theme that comes up everywhere we travel as to how can the hospital do more with less. And we think there's lots of opportunity there, don't you, Renee?
Yeah, and this conversation about the community benefit, what you just said about convening could be the piece that puts that together. Because if the hospital really could benefit a community if they use that role as, bringing other groups together and being a resource to the others, to like mentoring others, being the go-to for questions. But you're right, if you are just an isolated body unto yourself making a profit, it is hard to prove to the community benefit to others. But if you're seen as, part of a bigger system, like we've talked to several groups about convening and several groups about how they're doing those collaborations in northern Iowa, wanting to do one in southern Iowa, wanting to and doing them in Nebraska, that shows the value of the hospital right there. And then it becomes easier to sell that to your constituents or to legislators because you can show that it's not just about the hospital making profit. It's about, that's a key employer in the community. It's a key convener in the community. It's a solution location for a resource for other small providers, and you could really start to show the value. So I think convening really could be part of a solution.
And there's a pushback in Montana of some legislators who have now been labeled anti-hospital because they're questioning the community benefit.
Yeah.
that some of these hospitals are providing. And so
Yeah.
I think there's a lot of hospitals paying attention to how are they demonstrating their community benefit because they're getting questioned about what their margins are. Why do they have cash in the bank if they're a nonprofit? Legislators are paying close attention to that. And so it was interesting to hear about these anti-hospital legislators because I don't know what their intent is, but I found it an interesting conversation
Well,
that I've never thought of it in those terms in the way it was being presented.
you and I have talked about this. I mean, if we had legislators that understood that some of our, just in our state, some of our rural communities have these brand new spanking buildings that nobody's in, nobody's using. They've put a bunch of money into a new building. I could see getting to anti-hospital pretty quick if
Yeah,
I didn't see a bigger picture, right? Because you're spending all this money on all this pretty whatever and may or may not be making a profit, and they've put all these maybe tax incentives into that or whatever. And some of those nonprofits, if they're nonprofit hospitals, right, they're not paying into the tax base. So it's not a big leap to become anti-hospital,
yeah,
especially if you don't see some value. So that's why hospitals have the opportunity, as we've been talking about forever, to be valuable to the community in more ways than they think. But it takes some effort on their part. They can't just be in their own bubble, soaking up money from the communities and the foundations and all of that. If you're a legislator that cares about any other topic, it could pretty easy to be like, how is that not a thing? So you also mentioned CCBHCs in Montana. Are they doing that? Is that somewhere? It would be interesting to have that without
well,
Medicare, Medicaid. I mean, how in the world does all that go together?
so I think it's just that they're state hospitals, the Medicare Medicaid issue. I think CCBHCs is one of the pieces of legislation that's currently moving through right now, I think this week. And so I think the question will be if they pass that, they are going to count on federal funding to support it. And simply how do they provide the infrastructure statewide, right? Again, I
Mm.
think we're looking at a pilot that's only going to be in the populated areas, and it's going to again have and have nots. And this is kind of what I'm against every time we go and talk about this. If you can't figure out a solution for somewhat of a safety net statewide, then we shouldn't. Then is it really meeting the need? And so I'll be anxious to see how that moves forward, and what that legislation looks like, when it gets to the other side.
Well, you would think it wouldn't meet federal guidelines off the top of my head because the whole
Um,
concept of CCBHCs is that whole safety net and that your whole state is included, which is why some of our maps turned out as weird as they did in our state on that, because it had to cover the whole state for the federal government to approve it. Now, federal government can do waivers and they can do
mhm.
whatever they choose to do to go around that, but I would think that there has to be part of a plan to your point. Now, it won't, of course, be, I mean, I can imagine it not being equitable as we would
Right.
think of it, especially in the western part of that state. But again, way more cattle than people. So what that solution would look like out there is very different than on the east side in
We
Billings or in
we
the
did a
town of
poll.
Missoula, which is a bigger town with a university.
We did a poll again of how many people here have heard of 988. Guess how many
Uh-oh.
hands went up, Renee?
I hope not zero.
Zero at the table we were at.
Oh,
We had a
not
lawyer.
good.
We had a lawyer that works with a hospital and three other people. So, you know,
Uh-oh.
I ask that question regularly because of the lack of knowledge, and we're in this field, so we hear about 988 all the time, and so sometimes I wonder, are we really getting the message out as much as we think we are? And I always ask that back to states and others who are responsible for that messaging because it takes a long time to get these messages through.
Yeah. And I know you've got one more topic you want to talk to us about related to, I think, liquor licenses. I
I
cannot wait to hear this story.
do. You
So
just told us how prolific liquor was and how you
I
saw
know.
it
So what in the
everywhere.
world? There's a big old brouhaha about liquor
There's
licenses? Tell me
this
more.
is consuming the legislature right now, and it's House Bill 491. It's been an issue since 2019. It
Wow.
seems as though in Cowsbell, Montana, there's a
Okay.
retirement community, and they want to be able to have mixed drinks and wine down in the lobby and in the cafeteria and on movie night out on the grass. Or sometimes they have a concert out on the grass. It's their home,
Okay.
it's a retirement
Okay.
facility. Well,
Okay.
according to Montana state law, they would need a liquor license.
Weird.
They can
Okay.
bring alcohol from their rooms. They could bring their own blender and everything they need to bake their margaritas and ice from their rooms and bring it down to the cafeteria. But they can't be served that.
Oh,
And they can't, their families can't be served. And so they wanted to have a concert and they wanted to have wine. So their children and grandchildren can come and they could all sit and have wine on the lawn.
okay.
And the state intervened and said, no, you can't. And so
Oh,
they've been lobbying to change this law. And the Montana Hospital Association actually testified in support of this. So there's hearings
oh,
going on. But guess what? The Tavern Association is blocking it because there
oh,
is you can only have so many liquor licenses per population. And so this
oh.
throws off the equation of who gets a liquor license. So I thought it was fascinating that how these things are really taking up a lot of time in the legislature as being the biggest issue in the state right now, with people testifying and multiple hearings. It just caught my attention, Renee, because I'm fascinated when I find these things.
Yes, I love this so much. I mean, you've got the biggest challenge you have for substance abuse in your state is liquor. So the hospital association is for the bill. And then you have such a small community that you still have what all call taverns, which we haven't had for, the 1800s.
It's the
And
Tavern Association, Renee.
there's a whole association of them that are against it, and their job is to sell liquor. That is sums up the best. I love all of that. I don't even know where to begin, but I think we've got challenges, folks. Well, before we go, I'm going to talk about the recovering politician self-care policy of the week. And this is really truly about recovery. I had the craziest 24-hour plus travel situation this last time, never making it to Helena to this conference. And it takes time to recover after that. You have to be willing to maybe add an extra nap in. You've got to be able to figure out how to get back. When I got dropped off at Spokane, I was 2 hours off my regular timetable. So I was really didn't get to my hotel room till about 6 a.m. And anyway, it just went downhill quickly from there. So when you have something like that out of the ordinary, my tip and trick to you is you just have to recover, and that could look different over the next few days. You got to get back on your own timetable, but you may have to take extra naps, whatever it takes to get you kind of back. And didn't tell everyone, but I ended up sort of with food poisoning at the beginning of that stay. So it was just a rough, weird weekend. I enjoyed it. Spent a lot of time in very, very rural Montana and Idaho and part of Spokane, Washington. So had a great, crazy time that was not even on the calendar. So that's another part of being a recovering politician. You just go with the flow, be flexible. You never know where you're going to end up. Well, today we talked through the trip that Jason had, that I was supposed to have, to the Hospital Association conference in Montana. And we talked about some of the issues. And what's crazy is they're the same. The same issues that we hear here at home are the same issues that are happening across the country. And as you have continued changes in the federal government, we're going to have to see how that's going to work out with those certified community behavioral health clinics and how that's going to come out across the state. So if you're interested in following along, we put a lot of things in our show notes today that you could just get some information on what's happening in Montana. We hope to continue our work there, hope to continue helping in that state if we can. But before we go, we just want to remind you to please follow us on LinkedIn and Facebook. And if you send us a positive review on this podcast, we'll send you a prize. Thanks, everybody. We'll see you soon.